Hi, everybody. Today we are here to talk about a list of things to consider before having surgery or a procedure, whether this is you caring for somebody else, an aging parent, a spouse, grandparents, family member, or you caring for and deciding for yourself. So caregivers can be caregivers for other people, or you can care for yourself. And so a lot of videos that you might see on this topic might come from the healthcare system, so a hospital or a doctor or somebody else like that. And they may be talking about specific surgeries. So here we're going to talk about just general, any type of surgery, nothing specific, and all of the day-to-day considerations that the healthcare system might assume that you know as a patient or as a consumer, and then things that the healthcare system doesn't talk about because they don't know the burdens that caregivers go through. They don't know what a caregiver's life is like on any given day. So stay with me. I'm Pamela Wilson. Please like and share this YouTube channel. Press the share button on these videos down there. Share them with other people you know. I do videos every week in response to questions caregivers ask on a wide variety of caregiving topics. You can go to my website. It's PamelaDWilson.com. On there, my weekly podcast, The Caring Generation, information to my Facebook online private caregiver group, my blog, articles, a course, a lot of helpful information. So let's start with the list of things that you want to consider if you're looking at surgery or a treatment. And the obvious one is, why on earth do I need X? Why do I need to do this? And so what I find is that the definitions of like why a healthcare person thinks we need this and why we as a consumer think we need this are very different. So let's look at surgeries and just the simple thought of, is it planned? Does it go down this road, or is it unexpected and we just have to rush and make a decision? So if you're a caregiver, more than likely, you've probably had an unexpected situation that happened to a parent that maybe put them into a hospital. Maybe they needed surgery or didn't need surgery, and you went from there. But let's just use something freakish like a car accident, right? And you or a loved one is very seriously injured to the point that maybe you're on a breathing tube, you can't decide for yourself. You need your medical power of attorney to make that decision. And so we're going to assume that you've made your medical power of attorney documents and you've appointed someone. And let's just say that you have really bad head injury. And the doctor's saying, well, we've got to do surgery, the brain's swelling, there's all this stuff going on. And you're like, well, what's my husband or my wife or grandma or grandpa going to be like after the surgery? And the surgeon says, well, we don't know. Their brain activity might be good. They may not be able to walk. They may not be able to do all these things. And so based on what you know about this person, let's say they're super active. They go hiking every week. They ski. They like to go fish. They hunt. They can't imagine not having physical function or brain function. And that's information that you know, but that the physician or the healthcare system doesn't know. So it's important for you to bring this up because they're thinking, well, I've got to save this life. I've got to save this person. But yet you know what this person would want. And so in that case, you may say, no, we're not going to have this extensive surgery to try to save their life, because what I know is if we save their life and their quality of life is like this, that is not at all what they want. So this is like a super emotional decision because you as that power of attorney may think, well, I'm going to end the life of my spouse or my loved one, but really you're honoring their wishes to do what they would have wanted because they don't want to live disabled. They don't want to live if they can't go hike and bike and fish and do whatever it is they do, right? So for all of us, it's important for us to be as specific as we can about what we would want, especially considering that we could get hit by a car tomorrow. We could get hit by a bus tomorrow. Something could happen and we could be injured. Do you want your life preserved unnecessarily, Or do you want your life preserved regardless of the situation and you're willing to live with the outcome or the results? Now, thinking about this can be super, super difficult, especially if you've been healthy all your life and you've never been sick or hospitalized, because you don't have this idea of what it's like to be in the hospital for a day or 3 days or a week. And so if this is your situation, talk to somebody who's been hospitalized. Talk to your grandma or grandpa or aunt, uncle, parents, whoever, and ask them about their surgery. Did it go the way they expected? Did they recover the way they expected? Would they do it again? What would they do differently? What do they feel that they should have known that no one told them or asked them? And then most importantly, ask how this experience changed their beliefs or their perceptions about having surgery or things that they would want to have happen or not want to have happen. So somebody who's had surgery may say, I'm not doing that again. It was not good. If I die, it's my time, right? So if I had to guess, I would think that most people who had major surgery would be pretty honest if you ask about what they think. And so let's go to a routine surgery, right? Something that you have time to think about and you can ask a lot of questions. And so some questions to ask is, again, why do I need this? Is it necessary? Is there something else that could be done? Are there different types of surgery for this one thing? Less risky, less invasive, more invasive? What is my life going to be like after this surgery or procedure if everything goes well? And the same question, but if none of this turns out like expected, then what can I expect? Now, if it's a small procedure, something like, a test, like a mammogram or a colonoscopy or something like that, that may not change your life at all if you're in good health. Something, though, more extensive like open heart surgery or cancer or gallbladder is going to have longer and possibly bigger effects if you're not in really good health. So when you're talking to the doctor or the surgeon, how many surgeries have you done? What has happened to the people, as a result of the surgery? Are you board certified? How many of these have you done? Are you highly trained, experienced? How quickly am I going to be able to get my life back? Meaning resume normal activities, eat, exercise, go back to work, drive a car, or is that going to take a period of time? And again, on the end of the unexpected, what if things don't go well? What are my options? So you want to really look at the risks over here versus the benefits over here and see if they're, equal or if it's lopsided. And so if you're an adult who has chronic health issues, many people do, like maybe diabetes, high blood pressure. If your parent has dementia, that's a whole nother topic, because older adults who have a lot of health complications who go through surgery really have a harder and a longer road to recover. And some people who have memory loss, dementia, Alzheimer's, due to the effects of the anesthesia, they may lose a lot of their memory that they are never going to regain. So again, that question is, do we want to not do the surgery and keep mom or dad as well as we can for as long as we can? Or do we want to take this risk over here, hoping that it's going to go well, but knowing that maybe it won't? What would your parents really want? And it's important to understand, especially with aging parents, the aftercare. So after hospitalization or surgery, do they go right home? Do they go to a nursing home? If they go to a nursing home, how long are they there? And then how well will they recover? And will they need caregivers, somebody else, when they get home? And for how long? And for what types of activities? Is it going to be bathing and driving a car and cooking meals and going to the grocery store? So these are a lot of things that the healthcare providers don't think about, because they only think about you leaving the hospital, right? Or you leaving the hospital and going to a nursing home. And then maybe the nursing home staff might think of, well, what happens when you go home, but not really to the extent that you would, because you're the caregiver who has to do all of the work. And their goal is to just get you out of there, to get you discharged, to get you back home, wherever that may be. The other important thing to ask, and this is like surgery versus procedure, right, is where is this going to be performed? And I'll use an example of a colonoscopy. So some physicians, because they can make more money, will do colonoscopies in like a, what's called maybe like an off-site surgery center that's attached to their office. So it's not at a hospital location, but it's maybe next door to their office. Now, here's what you want to ask, okay? So some of those are not accredited. If something goes wrong, there's no hospital to like send you to right away. And even the more important thing is who's doing your anesthesia. Is it a real trained, certified anesthesiologist, or is it just some nurse who knows how to do light anesthesia and you hope everything is going to go well, and sometimes it doesn't. So never assume, if you're having a procedure or a surgery, never assume it's going to be in a hospital or in a location where there's emergency backups. Always ask, because then you have the opportunity to say no rather than showing up and then you find out, wow, there's no anesthesiologist here and I'm scheduled in like an hour. I can't change my mind. I have to go through this. I'm not uncomfortable. Because trust me, they are not going to tell you if you don't ask. The physicians who have these little centers, they want to make money. They don't want to have you go to the hospital because they make less money there, right? So again, depending on the procedure, depending on the surgery, make sure you ask where it is and all the other questions that relate to that. Anesthesia. If you've ever had a bad reaction to anesthesia, make sure you mention that. If you've never had anesthesia, make sure you mention that. Always find out what type of anesthesia they're going to give you, so after you can say, yeah, that worked out great. No, it didn't work out great. You know, some of these anesthesias have effects that it takes you a while to wake up and recover. Others, you wake up just like that. You just never know. You also want to be proactive and avoid financial surprises. So ask about your out-of-pocket costs if you have copays. Now, a lot of these doctor's offices are going to say, well, you know, we can't tell you that until like 2 weeks before surgery. Well, then it's too late because you likely have a cancellation fee. So what you want to say is, okay, anybody in a similar situation who didn't have a copay, what's the bill? Or call your insurance company and see if they can estimate for you. Call the hospital who's going to do the surgery. Find out, because you don't want to get a $10,000 surprise because somebody told you that it was going to be paid for, and then you find out that it's not. Those are not great situations. And last but not least, just realize that any type of surgery, it's a big deal because your body's going through, I don't want to say trauma, but kind of is trauma to your body, and your body has to recover from this. So think of going in for surgery like training for a marathon, or like trying to get in really good shape. If you're going to like a high school reunion or a college reunion, you want to like look good and lose weight and exercise and all that kind of stuff. The better shape you are when you go into that surgery, the faster and the better you will recover. The more health problems you have when you go into the surgery, the harder it's going to be and the longer it's going to be for you to recover. So that is something to think about and to mentally prepare for. Are you going to be up for the work that you are going to need to do to recover? And remember, you should ask about this. What is it? Is it hospital to nursing home? Is it home physical therapy? Am I going to be tired for 3 or 4 weeks? Am I going to have other symptoms? What is going to happen? Because really the goal of surgery is to kind of come out better than you went in, right? Although that's not always what happens if we're older and we have a lot of chronic illness, even if we're younger, or if we have dementia or Alzheimer's. You know, surgery is not this magic potion. Like, you know, we take a pill and we hope we're going to get better, and we go in for surgery and we hope we're going to get better. There's a lot of considerations, a lot of questions that we should ask before and after. So it's nothing to be taken not seriously, you just take a doctor's recommendation, you go for the surgery. It's important to ask a lot of questions and make sure that you're getting the questions answered from the physician that you're asking. If not, ask somebody else, go get a second opinion, see a second physician, talk about it with your family members. And most importantly, think about planned surgeries versus the unexpected. If you don't have your living will, if you haven't written down what you would want if something does not go the way you expect, what is that? Put it in writing. You don't want to be in a position where you're in a car accident and you can't make decisions and there's no legal decision maker to make decisions for you, because then the hospitals and the doctors will decide, and you may not always agree with those decisions. So much to think about, a lot in this video. Again, I'm Pamela D. Wilson. My website's PamelaDWilson.com. Please press the share button, like my YouTube channel, share these videos, go to my website. A lot of help, and support for caregivers and aging adults there. Thank you so much for being here. I will see you all again soon in another video.